Now, time to say a very good morning to Jamie Jenkins, independent statistician, political commentator as well. Jamie, very good morning to you.
Good morning, Mike. I'm sure if most people have got some doom and gloom after 3 hours of the Home of Common Sense, it's all pretty good, isn't it?
Well, I would have thought so, yeah. I mean, we try to keep people cheered up and entertained, and that last story about equality really did wind me up, but I felt quite happy talking about it, because, of course, everybody knows the definition of equality is now not treating people the same, huh?
Well, that's true, Mike, and I think you just led in with the stuff that I was going to come on and talk about with these GP appointments.
Yes.
And so I've been looking through, there's a lot of data that's been kind of published around this, but what does it mean for real people, I suppose? So about just under 24 million appointments in August. Now, caveat that appointments generally are a bit lower in August. I think that's probably a couple of factors at play, that obviously people are going on holiday, GPs themselves, there may be fewer appointments available. But of those 23.8 million, we did also see 1.5 million appointments for COVID vaccines, because obviously GPs, surgeries are still issuing those. But when you hear all these kind of appointments that are going on, you've got to remember as well, Mike, because people see these headline stats of how many appointments are face-to-face and how many people are going kind of into the surgery, that nearly half of all the appointments are actually in the surgeries and not with the GPs. So just remember that, they were the nurses and people are going in for, certain tests and things. So I would imagine most of those are more like face-to-face than the kind of the ones with the GP. So the face-to-face appointments, if we look pre-pandemic, it was about 80% of all the appointments in GP surgeries were face-to-face. That's now down, and it's about 58% in the most recent figures. And what I've heard some GPs talking about this, Mike, saying that not having these face-to-face kind of appointments means that they can see more people. So the proof's in the pudding there when you look at all the data. We're not seeing any more appointments nationally now than they were pre-pandemic. So that kind of doesn't seem to be happening. And why does this matter? Well, fewer face-to-face appointments. They will work for some, Mike, these face-to-face, non-face-to-face, telephone appointments will work for some. But we know, and you've been talking about it, it's not even for months now, it's probably for the last year, Mike, I think.
Well, I think so,
yeah. These lack of face-to-face appointments, you can start probably seeing the impact of some of this in kind of the back-end statistics, which are the death statistics that are coming from the ONS, that we talked a few months back about. More and more people are dying from non-COVID reasons and what you'd expect for the time of year. That's continuing to rise and stuff. And these lack of diagnoses is having a big impact on people's lives.
Yes. And isn't it interesting that, the police tell us that, there's no problems getting from point A to point B if you're in an ambulance. That's not necessarily true. There's a terrible problem in Scotland with ambulance services, as far as we understand it. But in terms of the GPs of England and Wales, what I find is interesting is that whenever you hear doctors talking on various different radio shows, whether it's mine or others, the ones who say, but we're operating completely normally, it's a kind of a line that's being put out by the BMA. But I hear more and more people every single day telling me that the NHS is not working properly, that they can't get to see a GP. And if you're an elderly person, you're not online, you can't fill out a form online, you're trying to get through on the phone and not succeeding because the line's constantly busy. It's a nightmare.
So, yes, but I think there's two factors at play here, Mike. And part of it is not the problem of the current GPs, and part of it probably is the way the practices are being run. So the first problem is that if you look at the number of GPs in this population per kind of head of population, we've got about 2.8 GPs for every 1,000 people. Now in Austria, it's over 5. In Germany, Italy, Lithuania, Norway, and Switzerland, they've got more than 4. So the chances of seeing a doctor, if you live in those countries, are higher than kind of the UK. Now, it's estimated there's a shortfall of 7,000 doctors. Interestingly, there were fewer medical students going in 2016 than there were in 2010. Now, Jeremy Hunt in 2015 was talking about 5,000 extra GPs by 2020. Well, the numbers have fallen, so that kind of prediction that he had has fallen on deaf ears. So we've really got this problem, Mike, where there's just not enough GPs. We know a third of all the GPs are over 55. So you've got that problem that this is bad planning now. And you talk about the HGV drivers as well, that we've just got bad planning that's gone on for the last 20 years in terms of the labour market, because older populations, you're going to need more GPs as people age, and people. And the other thing as well, Mike, is that we had a lot of misdiagnosis through the pandemic. So you could have a sudden surge of people going to the kind of GP surgery, but you just can't get the appointment. So the first problem is, like, it's not actually what the GP is offering. The first thing is, can you actually get to see a GP in terms of a telephone consultation or a video consultation or a face-to-face one? That is really difficult at the moment. And then on top of that, if you do get through, and you're lucky, you're one of the lucky ones to get through, the numbers don't lie. There's fewer appointments being offered face to face than kind of pre-pandemic. So you've got the two things coming together, which means that basically there's hundreds of thousands of people on a daily basis trying to phone the GP in the morning to get an appointment. They cannot. Some of them then try and rock up at A&E, which puts actually pressure on the A&E services, and some people just give up and they can't be bothered because they just. And then what's happening there, Mike, is people are dying, and ultimately this needs a solution. Now you can't get a GP, trained overnight. But what's the government plan? Because we don't want to be talking about this in another 10 years' time. They've got to put some proper planning in place so that maybe there's lots of free medical student places should be offered. Should they be paying for these things? Something needs to change, Mike, because this is only going to get worse. We know that we've got more of an aging population. These GPs over the age of 55 who are going to be coming offline, have we got enough people to replace them? And the thing is, Mike, this is a worldwide shortage as well. So you can't just say, let's get some people from abroad. That's what they're talking about with lorry drivers. We know lorry drivers is an issue abroad. This is a worldwide shortage. We've got a plan now. Otherwise, this is going to be exactly the same problem in the next 10 years, Mike.
Well, Jamie, as well as I do, that it's only going to be, a month and a half or so before we start hearing the warnings about the NHS being overwhelmed, the fact that we've got a crisis in the NHS, the fact that, only just last week did the NHS admit that it was now time to go back to putting beds 1 metre apart instead of 2 metres apart in hospital wards, meaning they can get more people in. And you still hear them saying, but we're in the middle of a pandemic. What is it that you want? Do you want the doctor to be able to see people who might infect him with COVID? Well, I'm sorry. Doctors are supposed to see sick people. You're not supposed to turn them away. That's not what doctors' job is.
No, exactly that, Mike. And I've heard stories where you've got to prove that you haven't got COVID to go and visit the surgery. And obviously, well, if you're ill, you want to go and see the doctor. So it's like the chicken and the egg situation there. I think, there's clearly some things that would benefit from change. So there's no point having, say, what we had pre-pandemic, where, say, 30 patients would be all sat in the waiting room. Some of them would rock up 20 minutes early, and then people are all kind of spreading germs, I suppose. I'm sure people can adopt an approach where people can sit in the car outside or just turn up when their appointments thing. But again, the numbers online, that's not really happening, Mike, because we've got this significant 22% of all the appointments now are less that were face-to-face before that aren't happening. Now, the NHS and the winter that's coming up, now I can guarantee the NHS will be overrun this winter because we know it's overrun every single winter. Now in Wales, they've got the plan A, which is asking people to work from home. They're going to be introducing vaccine passports. It seems to be in Boris's plan B, where those things will come in. Yeah. It's inevitable, Mike, that Boris will bring vaccine passports in because they've published in the most recent week now some consultation about the approach for vaccine passports. And just whilst I mentioned vaccine passports, Mike, Mark Drakeford planning on bringing them in. We know there's problems in Scotland with the app, but they published the day after announcing that they're going to introduce vaccine passports in Wales, the scientific paper that was the advice given to them. And what it says is that even with careful planning, there may be no benefit to all of this. Given the limited evidence for vaccine passports, you should try some trials. And the most interesting thing as well is that whilst evidence that it would be limited, that it will increase vaccines, they've actually suggested that it could backfire because it might be that people who haven't been vaccinated might resent the fact that these vaccine passports are coming in and not take the vaccine up. And also, it could impact on the trust with the government, which I think has been severely damaged over this pandemic. Now, if you look at the numbers, Mike, since the announcement of the passport a couple of weeks ago, there's been very little movement in the number of new people coming forward for first doses. So if they thought this is going to come in to try and get more people to take up the vaccine, it clearly hasn't.
And I wonder if that is the sole purpose of it. And I also wonder that if it doesn't work in terms of getting more people vaccinated, then Boris Johnson will not introduce it because there is no scientific case to make for vaccine passports keeping people any safer because it makes no difference. Whether or not you're vaccinated is obviously an issue for the government. They want everybody to be vaccinated. Not everybody wants to be vaccinated, but they're trying to make people insist on vaccination in order that they can go to nightclubs, in order that they can go to football matches, and people are just not buying it.
No, exactly that, Mike. And what the evidence is obviously emerging now as well with these with COVID is that people who've had a prior infection and haven't had, say, a vaccine, they're far less likely to probably kind of catch COVID themselves than people who've had the vaccine but haven't had a prior infection. That doesn't seem to be in place for the Scottish and Welsh approach of these vaccine passports because they're not testing people to see if they've got antibodies if they haven't had the vaccine. Now, I've talked to you on the show many times, Mike. It's quite clear the vaccines do have an impact, But that vaccine impact reduces as you get lower. And we've talked in the past about kind of vaccinations for children, and there's very little evidence that the vaccination for children is of any real benefit to them. And there also comes with the risks that the vaccine poses. So, people have made their choice. And the COVID vaccine rates, Mike, they're massive compared to what a flu vaccine would be. Right. And the flu is a dangerous virus as well. And we haven't gone in the past saying around, well, if you go back 5 years, we had a huge number of excess deaths in the country from flu with a mutant strain of flu, but we weren't going around saying everybody needs to have a flu vaccine. Protect the NHS. I
mean, you get one if you want. I mean, my kids' school do flu vaccines for the kids, and no parent minds that, because the flu vaccine is something that's been tried and tested and has been around for a long time. But you still don't have to have it. I don't know what your sense is about the rollout of vaccination for children in schools in Wales, but my sense that is in England, it's not really taking off.
I haven't, well, they haven't issued any stats on this one yet, Mike, in terms of how many are being rolled out. I think we talked about it as the announcement was coming out. And one of the things I think I was calling for is to not vaccinate within the schools. If parents, because I know parents who want their children vaccinated. It's personal choice. I personally wouldn't, but it's the personal choice of the parent. But for that, it would be far more sense to just go to the community vaccination centre if you want that, because I wouldn't want my child being kind of called out in class if they're the one or two who are not going forward, or even if you're a child who's the one or two are going forward for vaccine. This is private information. It shouldn't be done in school. So I know some schools, I've seen some letters from head teachers themselves saying that they're not planning on having any vaccination on site. They're expecting the vaccinations to go on in the kind of the community. And things have gone pretty quiet on these vaccinations. And what's driving the COVID rates at the moment are children, basically. So when you see these big rises in COVID rates, Scotland, interestingly, because schools went back a bit earlier, they've been showing over a couple of weeks, Mike, some sustained decline in COVID rates across the country, which is so maybe Wales is a little bit behind that. England's relatively flat at the moment, but the majority of the cases are among younger people. But there's an intervention yesterday in Wales where the Royal College of Paediatricians have called on to stop testing children who are asymptomatic with no symptoms, because false positives might mean they're not going to school, and it's probably having more of an impact, the paediatricians are saying, which you'd think, well, they're paediatricians, they understand the health risks and benefits for children. They've been calling on the Welsh government, similarly I suppose in England and Scotland, to stop mass testing of children, because it does find cases, but sometimes with very few kind of symptoms, or some of these false positives, meaning people are isolating from home, not in school, and it's having a damaging effect. Yes,
that's right. I mean, as far as I know, the schools in England were supposed to be reviewing the testing regime at the end of September. So today's the first day of October. You'd assume that they've done that review and will announce in some short time either they're going to continue with the testing or they're going to stop it.
Exactly that, Mike. And we by this weekend, what's remarkable, I think we're going to have 300 million tests carried out. And these are just the ones that have been reported. This is since the start of the pandemic, because there's loads of lateral flow tests, but I'm sure people are doing them, but they're not scanning in any results into the system, mostly with a PCR test. It goes up 300 million. It's a huge cost. These tests aren't free. There must come a point in this kind of, when this pandemic, which we've been through, is endemic, which you could say we're at that stage now, are we planning on testing for the rest of our lives? Because, are they going to start saying, actually, testing's a pretty good idea. Why don't we bring the flu test in and a test for something else? If we've been doing the amount of tests that we do for COVID, Mike, MRI scans for cancer, we'll probably find loads more cancers are positive to do that, obviously. But this testing can't go on forever. It was desperately needed through the pandemic. But if we're going to learn to live with the virus...
do you know what? You say it was desperately needed during the pandemic, but actually it's never really been a proper working system, has it? Because when we did need an awful lot of testing done at the start of the first lockdown, and between there and sort of the September time, the testing regime wasn't there. There wasn't any capacity for testing the numbers of people that we test now. And so whenever they are putting, year-on-year figures together, they're comparing apples and oranges, because they were, like, for example, in July 2020, they were barely testing anyone. So when we said in July 2021, look at the number of positive tests compared to last year, it's much worse. Well, it's not actually, because we weren't testing anyone.
No, that is true. I might tend to, when I'm doing all my kind of data comparisons, look at them back to last September, because you're right, first wave of the pandemic, very little testing going on because it kind of caught us by surprise. Now, the testing's gone through the roof as well. So that's, like in Wales in the last week, we've had the highest case rate from COVID since the start of the pandemic. But the number of tests have doubled as well. And you've got to put that kind of caveat in when you're looking at the numbers. Ultimately, it all comes down to kind of the death statistics. And a sad story, again, while we've been talking about this in the past, that in recent weeks, deaths have started going up in Wales, and England has been relatively flat. They're starting to come down, but they've been going up in Wales. And this coincides again. It happened exactly the same time last autumn as well, kind of when we went into September, with infections, people catching the virus in hospital. Nothing's been learned. Mark Drakeford in Wales doesn't want an independent inquiry as to the decisions he's made. And when we see these infections go up in hospitals, we start seeing the death figures going up quite sharply as well. These are the things that have the biggest impact. Vaccine passports for teenagers in nightclubs and young people in nightclubs are periphery in terms of the impact compared to these other impacts that the government seem to be ignoring.
Yeah, exactly right. I mean, I was talking to somebody today who took one of their kids to the James Bond film last night, said the cinema was completely full, nobody's wearing a mask, quite a lot of people were coughing. That's just the way life is. I don't know whether that's going to have any impact, and there doesn't appear to be anything that we're seeing, Jamie, from football matches to concerts to any number of large-scale events going on, weddings, various different parties and all the rest of it. Labour Party conference, Tory Party conference coming up. They're all singing into karaoke microphones. I'm not seeing a massive spike in infections. Are you?
No. So in Scotland, as I said, they've been coming down. Wales has been going up, but we may be hitting the peak there. But remember now, some of these predictions were like, what was it, 7,000 people per day going admitted into hospital. We talked about that last time on the show, Mike. That's currently knocked down to around 500 to 600 at the moment. The total number of patients in hospital has been coming down as well in England. It's around 5,000. And we had the stats up yesterday saying of those 5,000, about 27% of them are in hospital having tested positive for COVID, but are not in there for COVID as well. So all the indicators are going in the right direction. I suppose the one little small lookout that we've got at the moment is that we've seen the rising in children. We've seen some marginal upticks among some of their parents' age, but this isn't unexpected. The virus probably will rise a little bit during the autumn, winter months because people mix indoors more. But that was the whole point of the vaccine rollout, Mike, wasn't it?
Well,
we've got the vaccine. If you've got a vaccine rollout for people who are kind of vulnerable, they've been vaccinated. You can't live our lives for the next kind of 5, 10, 15 years where you've got to continue with the testing. And who's making all the money from these tests? Like all these lateral flow tests, ironically, made in China. Right. This is a huge global business for the Chinese in terms of all this testing that's going on.
Absolutely. Final question for you, Jamie. How's the petrol situation where you are?
Well, I kind of had to go back and forth Bristol a few times this week.
Oh, really?
Couldn't get any petrol over in England a few days ago. I had enough to kind of keep myself going. Managed to get some when I come back into Wales yesterday, but it's just carnage, Mike, this kind of whole petrol situation. And it comes back to the very first start of the conversation with this lack of planning for kind of doctors, lack of planning for HGV drivers and stuff. The government needs to think long term rather than just short term. Sending everybody to university, which is kind of what people were doing 20 years ago or 25 years ago when Tony Blair's in there. We need a proper government now who's going to forward plan for the next 20 years. Problem is, Mike, governments always think short term. And just on the fuel crisis, just to add on that, my energy company's gone bust. So my energy prices will be going up over the next few days as well.
Yeah, happy days, isn't it? Welcome to autumn, 1st of October. Jamie Jenkins, thank you very much indeed. He's our favourite statistician, always with some very interesting information. But this is the thing. We are still in the midst of this petrol crisis. I still say, just get 30 quid's worth, put that as a maximum, put 20 as a minimum, and you'll sort this problem out. Why do people not do what I tell them to do? Because that would be the way to go. This is Talk Radio.